have senators and representatives who are coming from the right place and who care about their constituents, and more than just their constituents, who care about every single person struggling, whether that's struggling with their health care, whether that's struggling with their housing, whether that's struggling with substance abuse, mental health care issues, or trying to access family planning and reproductive care. We have one of them with us today. He has introduced an act here in the Senate that passed overwhelmingly that would get a head start before regressive change comes down from DC by putting the patient protections that exist right now in the Affordable Care Act into our state law, and would protect people from being charged more, people like women, people like me who are between 50 and 64 years old. So I would like to introduce him right now to say a couple of words about that. Please welcome, with a big round of applause, Senator Josh Miller.
Thank you. This can be a lonely endeavor sometimes, so it's nice to be among more than a few people that feel passionate about what I've been trying to do up here. So this bill, which is called the Market Stability and Consumer Protection Act of 2017, is something I thought about after maybe sleeping for an hour or two on the morning of November 9th. On the morning of November 9th, 2016, I knew I had to help create legislation that protected what is in the ACA in Rhode Island. And we're not going to have a party in the Rose Garden because this bill has only passed the Senate in the Rhode Island context of what this effort is. And so we have a ways to go in the next few days in getting this past the House. So if you have any friends or elected officials in the House, you should explain how important this legislation is to you, that you want to protect essential benefits in Rhode Island, that you want to protect lifetime benefits, that you want to protect access to mental health, to maternity, prenatal, that you want to protect those who have pre-existing conditions, that you want to protect those who are the most vulnerable here. And so in the last few minutes, we got some support on this legislation because there are reps who have said, how expensive is this going to be? So we now have a letter within the last half an hour from the Director of EOHHS, Eric B., the Health Insurance Commissioner, Dr. Hittner, and the Director of Health Source RI to say they see no fiscal impact to Rhode Island, to the Rhode Island tax base. So this is really because we feel hopefully address the concerns of those in the House who haven't voted on this legislation yet. So I came out here and I still got other stuff to vote on, and I still got other legislation to bring forward in my committee. And so I want to get back to that important work, but I want you to understand that Karen Malcolm and many others have been working since about the same day, November 9th, 2016, to get legislation like this passed in the House and the Senate. And so don't think about rose gardens, think about bothering your reps so we can actually have something to celebrate. Thank you.